2. Talk about type 2. Now, the underlying factor in type 2 is insulin resistance. Okay, so the body is resistant to insulin. Because the body is resistant to insulin, the body produces more insulin. And the beta cells produce more insulin. The problem with that is the more and more insulin gets produced, insulin's an anabolic hormone, they put on weight. So in case you're wondering why most people with type 2 are overweight, well, it's purely because of the huge amount of insulin that's floating around their body. You should also have noticed by now how many people have type 2 diabetes, the hypertension, we'll say dyslipidemia, lipidemia, the obesity. How often these happen together? They're all part of the insulin resistance syndrome. It used to be called the metabolic syndrome, or the metabolic syndrome, and it's also metabolic syndrome, and it's also been called syndrome X. And the reason it's called syndrome X is because years ago people noticed these all happen together, so they just used that name, syndrome X. But now insulin resistance underpins all of them. That's why they all occur together. And there's also a thing called leptin resistance you'll come across that underpins that. Leptin is the hormone that the gut produces when to tell us to stop eating. Okay, so you often hear people talk about the obesity hormone, or every few years the news media runs a story that the cure of obesity has been found. All they're doing is trotting out the same old story about leptin. Leptin is when you've eaten enough, you produce more leptin, and you stop eating. So if people are resistant to insulin, resistance to leptin, they're going to keep on eating. That's my excuse. So that's the insulin resistance syndrome. That's what underpins type 2. So if I say to you in a clinic exam, what have all these things got in common? Insulin resistance syndrome, or the metabolic syndrome, or something like that. So you can see why, if they're resistant to insulin, the beta cells are going to produce more insulin, and they're going to put on more weight. Okay. So let's just rub all this off now.
Hey Craig, just a quick question. Is hyperlipidemia, what's the difference between that and dyslipidemia?
Okay, well, dyslipidemia is the more appropriate term to use, okay? Because you've got the HDLs, and you've got the LDLs, and you've got the VLDLs, okay? The HDLs, these are the good ones, okay? And these are the bad ones, and these are the very bad ones, and they're much more what they call oxidative. So to say that someone's got hypercholesterol, well, hypercholesterol of which one? If it's that one, it's a good thing. Generally, when they say hypercholesterolemia, this is the low density and very low density lipoproteins. Okay, they're the bad ones. They're the much more destructive ones. So dyslipidemia is the better term because it infers there's an imbalance. So dyslipidemia means that one's low and they're high. Hypercholesterolemia could mean any of them are high. Generally, it just means those two are high. So I prefer the dyslipidemia term, and I think so do a lot of others, because of these HDLs. These are the ones that are protective against vascular disease and they're the good ones. Okay, so let's just talk about management of type 2. Now, and I love asking this in a clinic exam. Okay, so if you were to invent a drug to treat diabetes, what would you want that drug to do? And especially if I ask the question about the drugs the patient might be on and you don't know. So being able to think, what I just went through on the physiology, if you think about it, there's probably 3 ways a drug could work, okay? One is increase pancreas, or let's say increase the beta cell production, okay? So even though they're resistant to insulin, you can still get the pancreas to put out more insulin, so they're going to respond, okay? Now, if you think about that, that's going to work really well in those who are not overweight. But think about increasing beta cell production in people who are overweight. Because increasing beta cell production going to increase insulin levels, is going to increase their body weight. So it's not very often, and occasionally we do see patients here who are on, who are grossly overweight on a sulfonylurea, which is what this drug is. I should have called sulfonylurea. Sulfonylurea, okay. And I don't think that, I don't, like I said, I'm not their doctor, so I don't really know, but to me it seems to be a bit dangerous. Okay, so there's increased beta cell production. The other one is increased insulin sensitivity. So make the tissues more sensitive to insulin. If a lack of insulin sensitivity is a problem, and that's what the metformins do. Metformins really just increase insulin sensitivity. But think about this is going to lower insulin levels. This is going to be really good in those who are overweight. They're going to lose weight, whereas this one's going to help them put on weight. So you can often, and again I can be a bit cheeky in a clinic exam situation, if you didn't know what drug they're on, have a go at telling me which one they're on. Well, if they're not overweight, they could be on either. If they're overweight, chances are they're on metformin or metformins. Okay. The third way is drugs that prevent glucose absorption. Prevent glucose absorption in the gut. Okay. And the classic drug there is archibose. Okay, so that's just, so if you think about it, if you're able to invent a drug to treat diabetes, there's your answer from your understanding of the physiology. Now, archibose is an interesting one. It prevents glucose being absorbed in the gut, in the intestines. Can you think of what might be the major side effect of that? What do you think happens to glucose if it was forced to stay in the intestines for longer than it probably should?
Would it be stored as fat?
Sorry?
Would it be stored as fat?
It stays in the intestines and it gets excreted, but it ferments. So what do you think the major side effect of archibose is?
Gas.
Yeah, gas, flatulence. Yeah, purely because the glucose is being forced to stay in the intestine. And but having said that, if you remember that story, you'll never forget about archibose as a drug. Now the other interesting thing about especially this one here is, like I said, insulin's banned for elite sport level purely because it's an anabolic hormone. The endurance athletes can use it to get more glucose into the muscles. It's also, exercise is good for anyone for a whole lot of reasons. And losing weight, blood pressure, just feeling better. The whole long list of reasons and benefits of exercise. There is one quite specific to diabetes, and exercise actually has the same effect as metformin. Exercise actually increases insulin sensitivity. So that's why people with diabetes are encouraged to exercise so much. But if you think about elite sporting exercise physiology, and at that level, insulin sensitivity is going to increase in anyone who exercises. And that means getting more glucose into the muscles, which means it's a huge benefit to endurance athletes. So that's why the body increases sensitivity in response to exercise, not just for people with diabetes. Okay, I think does all that make sense? This is something you should have covered in a much bigger, longer way. And I know the patients we've seen this morning, for most of you, that it fits in. The drugs they were on are the same here. Occasionally, it's around the other way. Okay, so let's stop there. Let's turn this off.